There's one sentence I keep in my head before every first case. You are responsible for this person's brain. It's not meant to be poetic. It's my ballast. The thing I cling to when the day starts early, the cases run long, and a surgeon's voice cuts sharper than the scalpel. It keeps me steady when my job is to take a human mind offline and then bring it back online exactly as it was. That morning, the pre-op holding area smelled of chlorhexidine and burnt coffee. 8 beds lined in 2 rows, curtains half closed, each patient with their chart, their IV, and their silent questions. Calder, Lawrence, 46 years old, 112 kilos, hypertension on a single drug, borderline sleep apnea without CPAP, ASA 2, scheduled for recurrent ventral hernia repair. On paper, a straightforward general surgery case, except for one note buried in the anesthesia concerns field. Patient reports awareness during prior hernia repair. Heard voices, felt pulling, unable to move. Denies pain. Awareness cases are rare, and they stain everyone involved. The chart from his 2021 surgery didn't fit his story. BIS monitor mid-40s throughout. That's unconscious territory. End-tidal sevoflurane perfectly stable. Vitals like they'd been drawn by a computer. If you'd shown me the numbers without the note, I'd have called it one of the cleanest cases I'd seen. But patients don't write these notes. Providers do. That meant someone believed him enough to log it. I stepped into Calder's bay. He sat upright on the gurney, gown loose at the neck, staring at a muted news crawl. His forearms rested on his thighs, hands motionless. Most patients fidget, fingers tapping, picking at the IV tape, but Calder's hands stayed perfectly still. "I'm Evan," I said, lowering my mask just enough for the introduction. "Your CRNA today. I'll be putting you to sleep." "And waking me up again," he said. The corners of his mouth tugged up, but his eyes stayed flat. We did the pre-op dance. NPO since midnight. No allergies, no loose teeth, Malampati 2 airway, neck moves freely. When I asked about previous anesthesia problems, he gave me the story I'd already read, but this time I caught the cadence. Voices. Male. Low. The sensation of pulling at his abdomen. Total paralysis. And one line, clear and calm. "We can't wake him up yet." "Are you sure it wasn't a dream?" I asked. "It didn't feel like a dream. Dreams change. This didn't." His gaze held mine a beat too long. "I'm not afraid of the surgery," he added. "I'm afraid of hearing that voice again." "I'll be right at your head the entire time," I told him. "We'll use BIS to monitor depth. Keep your gas levels tight. If anything changes, it'll be because I did it, not because we lost track." His shoulders lowered by a fraction. It was enough. OR 6 is one of our newer theaters. Brushed steel booms, LED surgical lights, laminar flow vents overhead that hum just at the edge of perception. First, the machine check. Oxygen, air, and nitrous pressures in the green. Circuit passed the leak test. Suction strong. Vaporizers full and seated. I drew up my lineup. Midazolam 2 milligrams for anxiolysis. Fentanyl 100 micrograms for analgesia propofol. 200 milligrams for induction, rocuronium. 50 milligrams for paralysis, phenylephrine and ephedrine. Ready because luck runs out fastest when you don't prepare. The BIS monitor, still in its foil packet, sat at the edge of my cart like a promise. Henley, the attending surgeon, entered with his usual clipped focus. Tanya, his scrub nurse, began the instrument count in a low, rhythmic voice. Josh, the circulator, logged into the charting station, the glow turning his mask pale blue. We wheeled Calder in. ECG leads, white on right, smoke over fire. Blood pressure cuff high on the arm, pulse ox on the index finger. BIS electrode diagonally across his forehead. Baseline 97. He stared at the surgical lights above him as if memorizing their pattern. "Deep breaths," I said, lowering the mask. 1, 2, hold. Midazolam first. The muscles in his jaw softened. Fentanyl next. The waveform on my monitor lengthened. Then propofol, slow and smooth. Eyelids fluttered, then closed. BIS dropped, 88, 74, 60. Rocuronium emptied his jaw of tone. Blade in, grade 1 view, cords clear and white. Tube passed, cuff inflated. Capnography rose in a clean square wave. Ventilator on, 500 millilitra tidal volumea. 12 hengitystä minuutissa. Sevofluran at 2.2%. Oxygen-air mix at 50-50. BIS settled at 44. First 40 minutes. Textbook. Heart rate mid-70s. MAP 80. SpO2 99%. End tidal sevo between 2.1 and 2.3%. Henley's cautery left that faintly sweet, wrong smell in the air. Tanya's Mayo stand chimed in soft metallic notes. It was the kind of case you wish all cases were. Quiet, clean, controlled. At minute 45, BIS crept up. 44 to 49 to 57. Heart rate ticked into the high 80s. MAP rose to 138/82. I nudged Sevo to 2.5%. BES fell back to 46. I told myself it was just surgical stimulation. We were at fascial closure when it happened. Lawrence. The voice was low, male, close enough to feel. I looked up. Henley tied sutures. Tanya counted forceps. Josh typed. No one's lips moved. BIS, 45. Vitals, unchanged. You can't wake him up yet. Same tone. Same calm delivery. The sound wasn't coming from the page system or the hallway. It wasn't even directional. It was just there, evenly in the air. My hands finished the case on autopilot. Gas down, Sugamidex in, breaths returning, tube out, oxygen mask on. Halfway to PACU, Calder's lashes tremored. His lips fogged the mask. You heard it too, he said. I didn't answer. Back in the anesthesia workroom, I logged into the OR audio archive. Every theater has a boom mic in the surgical light, feeding audio to a server for documentation and medico-legal review. I scrubbed to the last 20 minutes of the case. Tanya's count, suction hiss, soft instrument clinks. Then, Lawrence. You can't wake him up yet. It was faint, but perfectly clear. The waveform was wrong. Too clean, too narrow in frequency. No ambient wash around it, like it had been placed into the recording rather than captured by the mic. I listened again and again until the office's hum became a pulse in my ears. The recording looped in my headphones long after the case was closed. Lawrence, you can't wake him up yet. Each replay made it feel less like something heard and more like something inserted. Too clean, too isolated. No bleed from the surrounding noise. And the worst part? It didn't sound accidental. It sounded deliberate. I archived a copy to my own encrypted drive, a habit I'm not proud of because OR recordings are supposed to stay in the system, and shut the monitor before someone could look over my shoulder. 2 weeks later, I saw his name again. Calder, Lawrence. I and D groin abscess, or 4. MAC sedation. MAC, monitored anesthesia care, is the opposite of general anesthesia's deep dive. The patient's awake or lightly sedated. We titrate meds so they're comfortable but responsive. For a simple abscess drainage, it's about as low risk as an OR case gets. The smart thing would have been to trade assignments with someone else. I even thought about it as I stood at the board. But if what I'd heard had really been real, maybe this was the only way to find out. OR4 is one of the older rooms. The paint's a shade of beige you only get when the original white has been slowly roasted by decades of overhead lights. The laminar flow vents hum a little louder than the newer rooms, and the ceiling boom mic is the same model, in theory feeding into the same server. Except when I checked the status, OR4's primary mic had been offline for 3 days. The only ambient audio coming through was from a hallway boom outside the scrub sinks. It was impossible for that to pick up anything inside the OR clearly. The steel doors, the positive pressure airflow, and the distance made sure of it. I set up the nasal cannula with integrated capnography, checked the IV, and laid out a modest drug lineup. Midazolam 1 milligram, enough to take the edge off fentanyl 50 micrograms for comfort. A 20 milligram whisper of propofol. If he got restless, Dr. Patel was scrubbed in for this one. Soft-spoken, with a habit of humming tunelessly under his breath while working. Carla scrubbed, Mark circulated. Just something to help you relax, I told Calder as I connected the syringes. You'll hear us talking, but you'll be comfortable. Awake enough to hear voices? He asked. I kept my tone light. Awake enough to hear us. Midazolam in. His shoulders let go of some invisible tension. I gave him a little propofol push, just enough to blur the edges without dimming the lights. Patel infiltrated local anesthetic around the incision site. Calder winced briefly, then let out a controlled exhale. The case moved in small sounds, the clink of forceps in a metal bowl, suction clearing a small cavity, irrigation running clear. Patel's hum filled the spaces between monitor beeps. And then, Lawrence. The voice was exactly the same, low, male, close enough to touch my ear. You can't wake him up yet. No BIS to glance at this time, no sevoflurane dial to nudge. Calder's vitals didn't budge, and yet his eyes, half-lidded from sedation, shifted toward me. You heard it too, he murmured, barely audible over the monitors. The words went straight through me. In PACU, I kept my face neutral. I charted like nothing had happened. But my next stop wasn't the lounge, it was IT. Raj, the on-call tech, scrolled through the logs. Yeah, primary Mike's been dead in 4 for a few days. Whole case got picked up by the hallway boom. Could that bleed in? Like if the doors were open? I asked. Not clearly, he said. It'd sound like someone yelling from another building. But when he pulled the file, it was there. Lawrence, you can't wake him up yet. The voice was as close and clean as it had been in Oregon 6, even though the only mic was 30 feet away behind a closed door. That night, I dug deeper. If this wasn't Calder specific, if it had happened to him twice, it might have happened to others. There had to be evidence. I filtered the archive for cases with ambient audio anomalies. Most were nothing. A dropped instrument sounding like a gunshot. A radio left on in an adjacent room, someone swearing off mic. But then I found it. General Surgery, 2022. Peter, you can't wake him up yet. Ortho, Spinal Anesthesia, 2020. Margaret, same cadence, same pitch, same calm intrusion. Cardiac, 2019. Daniel. The voice never shouted. It never varied its tone. Always a name. Always the same sentence. My pulse picked up as I built a folder. 14 clips spanning 3 years, all from different rooms and cases. The patients were of all ages, sexes, and procedures. The common factors? None. At least not yet. The spectral profile was always off. The same unnaturally narrow frequency band. The same absence of ambient wash. Like the voice wasn't traveling through air at all. I didn't believe in ghosts. I still don't. Or at least, I don't think I do. But I know an impossibility when I hear one. And I knew I wasn't the only one who had. Grace came to mind immediately. Scrub nurse. Been here longer than most of the attending surgeons, the kind of OR veteran who knows which brand of suture each surgeon prefers, even if they pretend they don't care. If there was institutional memory about the voice, it would be in her head. I caught her in the substerile corridor between OR 3 and OR 4, steam from the autoclave rolling past her like fog. You ever hear anything weird on OR audio? I asked. Her eyes narrowed. Define weird. Voices that aren't anyone in the room. She studied me for a moment longer. Who told you to ask me that? No one. I've heard something twice. Same words both times. She set down the tray she'd been drying. How many people die in hospitals, Evan? You know the stats, I said. How many die in ORs? I hesitated. Enough. In the 90s, cardiac case went bad. Just before the attending called it, a nurse heard a voice say, "You can't wake him up yet." First time anyone admitted it. I've heard it twice since. Both times the patient coded. She turned back to her tray. Conversation closed, but the way she'd said, "admitted," stuck in my head like a splinter. That night, I cross-referenced my 14 clips with OR staffing rosters. One name appeared in 9 of them. Whitaker. Grace. I didn't go straight to Grace. 9 appearances in 3 years was too big a number to be coincidence. But if I came at her with that fact cold, she'd clam up or, worse, start watching me the way I'd started watching her. Instead, I went back into the archive. I filtered for only the cases she'd been in, whether as scrub, circulator, or relief tech, and then played them in chronological order. The first was from 2017, laparoscopic cholecystectomy, BIS mid-40s, Savo steady. Patient's name, David. The closure was quiet, except for instrument counts and the sound of suction. Then, at 1:47, "David, you can't wake him up yet." The patient survived. The attending anesthesiologist, dead 2 months later in his sleep. I opened the next file. 2018, knee replacement under spinal anesthesia, patient awake, chatting about his granddaughter's soccer game. Grace was circulating. "Elaine, you can't wake her up yet." The patient laughed at something the surgeon said. She clearly hadn't heard it. The ortho rep in the room died in a car crash 6 weeks later. File after file, the pattern repeated. Sometimes the patient died in the days after surgery. Sometimes they lived. But someone in the room, surgeon, tech, anesthesia provider, didn't make it out of the next few months. Stroke, cancer, MI accidents. Not every voice incident ended in death. But enough did that I stopped trying to call it random. Grace was at the scrub sink outside OR 8 when I decided to stop dancing around it. She'd just finished a case and was rubbing her hands with the kind of efficient aggression you only get after 20 years in gloves. "You've been in the room for most of the voice cases," I said. She didn't look up. "Is that what you call them? Voice cases? What do you call them?" "I don't." She rinsed, grabbed a towel. "You know why?" "Because people think you're crazy," I said. She met my eyes finally. "Or worse. They think you're cursed." We moved to the substerile room, the door shutting out the sound of the OR. She poured herself burnt coffee from a stainless urn, black and scalding. "In the 90s, she began, "we lost a CABG patient on bypass. I was scrubbed. Just before anesthesia called it, I heard a man's voice behind me. 'You can't wake him up yet.' Nobody else reacted. I told myself it was in my head until the anesthesiologist who ran the case died in his sleep 2 months later. Healthy. No warning." She sipped, the steam curling past her glasses. "I've heard it twice since." Both times the patient coded in the room. That's when I decided it was about them, about the patient. "But it's not," I said. Her eyes narrowed. "You've been listening. I've been comparing. The patient doesn't always die. Sometimes it's someone else in the room." Grace didn't speak for a long moment. Then, "Not every time, but enough. And when it's not the patient, it's someone who heard it." The coffee in my stomach felt heavier. "Meaning? You think you're safe because you're behind the drape, charting vitals. You're not. If it knows you can hear it, you're in its book." I hated the way she'd said "it." Not the voice, but "it." Like the sound was just the part we could perceive. The ripple of something larger moving underneath. "What does wake mean?" I asked. I used to think it meant emergence, like they weren't ready to come out of anesthesia. Then I noticed people dying weeks later, waking up in another sense. My throat went dry. "You think it's talking about life or death?" She shrugged. the motion small. I think it doesn't mean what we mean, and I think you'd better decide how curious you want to be. That night, I sat at my kitchen table with the folder of clips open on my laptop. 14 files, each labeled by case number and date, each with the same calm voice, the same sentence. I lined them up in an audio editor, stacking the waveforms on top of each other. Every "you can't wake him up yet" was the same length to the millisecond. The spectral profile was identical, not similar. Identical. No two human voices are perfectly identical across years. Even recordings of the same person vary slightly with the acoustics of the room. But this was like dragging and dropping the same clip into different files, except it wasn't in the file as data, not in the metadata, not in the bit stream. I'd already checked. It was like the server remembered it and reproduced it when the right trigger hit. The board didn't wait for me to sort out my theories. Or 6, recurrent ventral hernia repair. Calder, Lawrence. His hernia had come back again. Same surgeon, same diagnosis, same room where I'd first heard the voice. I stared at the schedule. Every rational instinct said to step aside, to let someone else take the case. But I couldn't. If the voice was real, if it was something more than a glitch, I needed to know. And Calder had heard it too. Preparation turned into ritual. Gas lines checked twice. BIS electrode placed with surgical precision. An independent lavalier mic clipped under the drape, wired to a portable recorder in my pocket. Completely separate from the OR system. If it came again, I wanted a copy that wasn't in the hospital's hands. Calder lay on the gurney in pre-op, gown loose at the neck. His eyes found mine immediately. "You know it's coming," he said. "Yes," I told him. "You going to talk to it?" "Yes." His mouth twitched, almost a smile. "Then maybe we'll both get answers." The morning of Calder's third surgery felt wrong from the start. Not bad weather, not some tangible omen, just a density in the air like the hospital walls were holding their breath. OR6 was already humming when I walked in. The overhead LEDs were at their pre-op brightness, cool white and flat. Tanya was scrubbed early, sorting sutures with the precision of someone who wanted everything ready before anyone could ask. Josh tapped through the anesthesia machine check, my job, but he'd jumped in while I was still in the lounge. Henley arrived 5 minutes later, hair damp, coffee in hand. No one seemed in a talking mood. The machine passed its check without complaint. Oxygen at 1000 psi, air at 800, nitrous topped off. Vaporizers full, circuit tight. Today's drug lineup was deliberate. Midazolam 2 milligrams, enough to ease him in without fuzzing the edges too early. Fentanyl 100 micrograms for the first incision. Propofol 200 milligrams, my clean dive into unconsciousness. Rocuronium 50 milligrams, paralysis without bradycardia risk. Sugamadex ready for reversal. Phenylephrine and ephedrine loaded. The BIS strip was still sealed in foil. I set it on the cart where I could grab it at the last possible moment. The independent lavalier mic, black, thumb-sized, I clipped under the drape area, running the wire down to the recorder in my scrub pocket. I tested the levels. Crisp, close, perfect. Calder was already in pre-op holding when I arrived. Gown loose, vitals steady. He turned toward me as if he'd been waiting for the exact moment I walked in. "You ready?" he asked. "I am," I said. "You sure?" "Sure enough to be here." He nodded once like that was all the reassurance he needed. In the OR, the process unfolded like choreography. ECG leads, white on right, smoke over fire, BP cuff high on the left arm, pulse ox on the right index, BIS strip across the forehead, baseline 96. "Deep breaths," I told him as the mask came down. 1, 2, hold. Midazolam in, fentanyl. Propofol, slow push. BIS fell, 87, 73, 59. Rocuronium slackened his jaw, Blade in, cords in perfect view, tube passed, cuff inflated, capnography a neat square wave, ventilator on, 500 millilitraa, tyydyttävä tilavuus, 12 kertaa minuutissa. Sivo at 2.2%, O2/air 50 to 50. BS holding at 44. Henley opened him with the efficiency of someone doing their third hernia repair of the week. Tanya passed instruments with the quiet rhythm of years in the job. Josh typed without looking up. The first hour passed without event. BIS steady, vitals solid. The independent recorder's LED blinked green in my pocket. At 1 hour 23 minutes it came. Lawrence. The voice was exactly as before. Low, male, as if it existed inside the space behind my ear. You can't wake him up yet. My hand tightened on the sevoflurane dial. I forced myself to keep my tone level. I hear you. A pause, long enough for me to hear my own pulse in my ears. You're ready, it said. For what? Trade? I'd been expecting the script, the same 7 words. Hearing anything else was like watching a statue turn its head. What trade? I asked quietly. He wakes. You stay. The words were steady, without threat or malice. They were simply a statement of terms. And if I don't agree, then neither of you wake. I looked down at Calder. BIS 44th, vitals perfect. The ventilator sighed in rhythm. Henley tied off a suture. Tanya murmured, sponge counts good. What are you? I asked. The pause was longer this time. When it answered, the voice was almost gentle. The part that listens when you can't speak. My thumb hovered near the vaporizer switch. I could cut the gas, let Calder rise and see what happened. I could keep him under and see if it blinked first. Grace, standing at the far side of the drape, glanced up at me. For a second I thought she might be hearing it too. Why me? I asked. Because you answered, it said. The last knot was tied. Henley stepped back. The case was over. The choice wasn't. Gas down, Shugamadex in. BIS climbing 52, 64, 78. Tube out, mask on. Calder's eyes opened halfway to PACU. He looked at me and whispered, You stayed. In the empty OR, I pulled the lav mic from under the drape and played back the last 5 minutes. Every word was there, my questions, its answers. The spectral profile was unlike any human voice. Flat where it should have had peaks. Sharp where it should have blurred. When I looked up, Grace was at the door. You'll start hearing it outside the OR now, she said. She left without another word. The first time it reached me outside an OR, I was halfway down the staff corridor with a cup of coffee that tasted like warm coins. The floor vibrated faintly under the weight of a passing bed. The air smelled of laundered sheets, gel pads, and whatever central sterile uses to make plastic smell like rain. I was thinking about nothing at all, a luxury you don't notice until it's gone. Evan, not loud, not even a whisper, really. More like a word placed on the membrane of the world behind my left ear. I stopped. 2 nurses ghosted by with a linen cart. A resident jogged past, already late. No one's mouth had formed my name. I waited for the sentence that usually followed. It didn't come. Just the hum of the building and the throb in my own neck where the pulse gets too honest. I told myself it was cortisol, sleep debt, fixation. I told myself a lot of things that sounded like medicine and felt like superstition. That night I slept with the portable recorder on my nightstand, a habit that made me hate myself a little. At 2:19, my phone lit with a voicemail notification. No missed call, just the badge. I pressed play. Breath. A long, measured exhale, like the one I'd found buried beneath the OR clips when I wasn't ready to call it anything yet. Then, "You're listening." The voice had never said I. Never said we. It only named, instructed, refused. Hearing it marked me as a state, not a person but a behavior, felt worse than intimacy. In the morning, I wrote it in the log. 219, apartment, VM without call. You're listening. I didn't know what I hoped the accumulation of evidence would do besides make me complicit. Work didn't slow down because my head had begun to ring. On Tuesday, I ran back-to-back ortho cases in OR9. Spinals, chatting patients, the soft confidence that comes with preserved airways and visible breathing. During a total knee, the patient was telling me about her granddaughter's science fair. The surgeon asked for a different blade. The rep said they didn't stock that one anymore. You can't wake him up yet. Not her. Him. The voice folded itself under the room like a layer of flooring. I looked at the rep and thought of the 2018 case where the voice had named Elaine and the ortho rep had died 6 weeks later on an empty stretch of highway. Everything okay? The patient asked. Perfect, I said, and smiled behind the mask with a mouth gone dry. Later, in the lounge, Grace watched me pour coffee I wouldn't drink. How bad? She asked. It's around, I said. It will be, she said. It tends to spread to the doors you leave open. What does that mean? You're making a place for it, she said, not unkindly. Logs, recorders, attention. It knows where you live now. Does it ever stop? I asked. She considered. It gets bored if you won't play, sometimes. Or it waits until you think it's gone and asks a bigger question. What's bigger than trade? Her eyes didn't blink. Choosing when you're tired. I stopped wearing the lav mic at home. I deleted one voicemail without listening. The next night, 2 arrived. The messages were short, always, the way a verdict is short. 0041. Almost. 0307. Ready. Ready for what? My mind asked, which was the same mistake as asking who are you inside an OR. I tried to starve it. I let days pass without replaying the OR files. When it spoke in the staff elevator, not yet. I pressed the button for the wrong floor and walked a lap around the cardiac wing, where the air has its own weather. In a PACU bay at change of shift, it said, "Listen," so close to my ear that Melissa, the nurse, turned and asked, "You say something?" "No," I said, honest and not. Calder came back for a follow-up clinic visit 2 weeks after the 3rd surgery. I didn't see him in clinic. We don't own the clinic. But I saw him anyway, in the hallway near the atrium, the lobby light turning his skin the color of wax paper. He was moving carefully, hand over his abdomen, as if the incision could be persuaded with kindness. He saw me first. "You look tired," he said, and smiled with his eyes because he'd learned the trick I couldn't pull off. "Occupational hazard," I said. "How's the pain?" "Livable," he said, then quieter. "Thank you." "For what?" "For staying." I wanted to say I didn't choose anything. I wanted to say I only turned the dial a hair and told myself it mattered. I said, "You're welcome," because that's the sentence that doesn't make anyone worse. "Is it still talking to you?" he asked. "Some lies exist to keep doors shut." "Sometimes," I said. He nodded, like that was what he'd expected. "Don't answer it again," he said. "It likes when you answer." He walked away with that careful gait. I watched until the atrium swallowed him. I didn't put the encounter in the log. You don't catalog prayers. I tried to test it once. That's how I know I was already losing. A routine general surgery case in OR5, BIS steady, Sevo steady, the room pulling toward closure like a tide. I'd gone a whole 48 hours without hearing it. In the space between Tanya's sponge and scalpel, I said out loud, so softly the mic might not have caught it, "I don't hear you." Silence. Tighter than quiet. The way you feel a negative space when someone who should be in it isn't. Then, softer than any previous incursion, as if it wanted to prove volume had never been the point. "You do." The BIS didn't move. The patient didn't stir. The scrub nurse didn't glance up. I felt something like heat behind my eyes and hated myself for giving it what it wanted. proof. The board delivered its own cruelty. OR6, complex ventral hernia, not Calder. A different patient. Same surgeon. Same room. My hands set up the cart automatically. My mind wrote the play before the actors came in. It didn't speak during induction, or incision, or even closure. I kept waiting until the waiting itself became a noise. We rolled to PACU in a corridor full of voices and carts. In the space where the threshold between temperatures sits, or air letting go to hallway air, it said, "You're late." The words hit like a hand on the back of the neck. Late? For what? I thought, and then was angry with myself for thinking, for letting it see the shape of the question. Melissa took the handoff, smooth, professional. "Everything good?" she asked. "Perfect," I said again, and hated the word for its usefulness. Sleep got weird, not just the content of it, the nature. I would lie down and feel the moment consciousness gets handed to the part of you without a name, an exchange I orchestrate for a living. And in that hinge between states, I'd hear a long exhale that wasn't mine. Once I woke with my hand extended, palm up, as if I'd been offered something. The position made my shoulder ache. I left it there a beat longer than I needed to, as if holding nothing was a kind of practice. I scheduled a vacation and canceled it. I told myself leaving would be giving it a stage somewhere else. I told myself staying was being useful. It's remarkable the number of stories you can tell yourself in the space of typing a request into the staffing system and hitting backspace. On a Thursday that smelled like rain in the HVAC, I found Grace in the equipment room, restocking trays with the unhurried efficiency of someone who understands that speed lives in the layer beneath haste. For a long minute I said nothing, just listened to the metal and plastic settle into foam. "Does it ever ask you a question?" I said finally. She slid a retractor into its slot. "Not at first." "And after?" Her shoulders rose and fell. It asked, "Are you tired?" Once. The way a person asks if you want to sit. "What did you say?" "I said yes," she said, and the sentence hung in the air like a dropped instrument that never hits the floor. "Then I didn't hear it for a year." "That sounds like winning." "It sounds like it decided to wait," she said. "Patience is the one resource hospitals never run out of. Buildings learn it from us." "Is it about death?" I asked. "I meant, is it a psychopomp, a ritual, a rule?" "It's about attention," she said, "and costs." She closed the tray. "You already paid part of yours." The final thing happened on a day that otherwise didn't. Or two, laparoscopic appendectomy converted to open. Easy airway, easy line, a resident doing the closing while the attending dictated into a headset. The hum of the room was comforting, the way white noise is comforting when you're exhausted and want your senses smoothed. The voice didn't say the sentence. It didn't say my name. It didn't say trade. It said, with the measured patience of a person explaining a procedure they have performed many times, "When you turn the dial, decide who you're talking to." I had my hand on the vaporizer, not moving it, just resting there like a superstition. The room smelled like cautery and saline and adhesive. The BIS sat at 45, the number I have loved and hated in equal measure. "Not yet," I said, out loud, the way you tell a patient in pre-op that you'll be there when they wake. I don't know who I said it to. The voice, the room, myself. All the people whose names had been spoken by something that doesn't have a mouth. The scrub nurse didn't look up. The resident tied the last knot. The ventilator sighed. I turned the dial a fraction and watched the number rise like a tide. There isn't a clean ending. If there were, we'd file it, present it, pin it to a bulletin board with a lesson learned and a protocol attached. Instead, there's a recorder in my pocket with a handful of files I'm not ready to erase and not brave enough to show. There's a log on my phone with timestamps that look like coordinates. There's a sentence I hold like a prayer and a blade. You are responsible for this person's brain. Sometimes, walking the corridor between the lounge and PACU, I feel the pressure change when an OR door opens somewhere I can't see, and I hear a breath that might be ductwork and might be something else learning how to be patient. Sometimes in the apartment, in the dark between the refrigerator's cycle and the radiator's knock, a voicemail arrives without a call and says nothing at all, and it's worse than the ones that do. I haven't answered again. That's the truth I can live with. Not yet. But I keep my hand near the dial the way a person rests their palm on a sleeping dog. Gentle. Ready. Practicing the decision I keep not making in case the day comes when the question won't accept silence. The building breathes. The rooms trade their air. The voice is patient. And now, so am I.